So I wanted to cover our project design goals. So first of all, we want the fast-wearing parts to go from failing like at 6 to 9 months to lasting 2 to 3 years, and then the expensive parts to last 10 plus years. And then we want to eliminate corrosion from the pipes and excessive lead and iron from the water. And once we've done this comprehensive review, upgraded all the components that are deemed upgradable and impacting people's lives, then we want to look at lobbying we want to advocate for the updating of the standards. And so that this longer life pumps will be spread across and be blended into future pumps that are built. So now for a brief timeline history. At the top you see the history here of WaterAid and Paul Dahl's partnership. They started the hand pump improvement project in 2018, but they actually started working on a riser pipe improvement back in 2004. So it goes back a long ways. And then in 2022, they kicked off phase 2 of that project, and you're going to hear more about this project from Comfort here to my left. On the second line, you can see where Design Outreach and Paul Dahl started working together in 2022 to look at both AfriDev and India Mark II upgrades. And we started field testing components in 2023, and that is ongoing. And you'll hear more about that, our Malawi experience, from Jeremiah on the end. And here at the bottom here, we have a new partnership, Design Outreach, with Living Water International, and Chris will tell you more about that project that's kicking off as we speak in Zambia. Thank you. And so we're going to focus in, I'm going to focus in on just a few components very briefly, and you'll hear more about that from the speakers to my left. But I wanted to mention we did a comprehensive review of both the India Mark II and the AfriDev pumps. But what we're trying to do is focus on the components first with the highest impact. And so one of those is the AfriDev centralizer, and you can see it here. This goes on a pump rod, and its purpose is to keep the pump rod from wearing a hole in the inside of the riser pipe. And Jeremiah will tell you more about that later, but you can see this blue one here. This one little part could save 70 to 80% of the breakdown cost of the AfriDev. It's a game changer, and you'll hear more about that from Jeremiah. Another one, and keep in mind, both of these, you can have a $1 part, and if the pump continues to be used, which it will be as long as water comes out, there'll be a knock-on effect, and it could cause a $10 part to fail. And if it keeps being used, it could cause like a $120 part to fail, like this pump head. And handle bearings is another thing we are also working on that has those knock-on effects. And we plan to have one that has a longer life than the current one. And next I'll mention the Paul Dahl riser pipe system, which is being used in Uganda. And this eliminates all the corrosion, all the red water that comes out of the spout due to GI pipes. And you'll hear more about that from Comfort with her experience with WaterAid and Paul Dahl in Uganda. And with that, I'll pass it on to Comfort. Thank you.
Thank you very much. Good afternoon. I'm lucky to start presenting when the mic is on. For the people online, a very good afternoon, and thank you for choosing to be here. You could have chosen to be somewhere else. My name is Comfort. I'm the Director of Programs at WaterAid Uganda. And I'd like to give special thanks to Alfred, who has been part of this longer than me, been part of this amazing work for the past 1 year. So WaterAid Uganda is part of a global federation of over 24 organizations across the world. And our sole purpose of existence in Uganda is everyone everywhere having access to sustainable, safe water wherever they are. And this is because we operate in a setting where the highest burden of disease is actually preventable, which means if we all invested in water, sanitation, and hygiene and made it our business, then the money that we'll lose in hospitals then would be invested to make lives better. and then redefine the definition of health as not ill health, but not health at home. And we know that as WaterAid, for us to have water that is safe and accessible by everyone, it has to be reliable. And it's not reliable if it cannot withstand the adverse events of climate change. And so we will also focus on making sure that WASH infrastructure designs, service delivery models are all resilient to the stresses, adverse weather events. With hope of reaching 5 million people, we've started this journey. We're halfway the journey. But we're aware that, Mike talked about the health system strengthening approach, we're aware that we cannot do this alone. And so we value the partnership that we share with everyone, including the CSOs. Some are not here, but I know we do a lot of work around stopping the rot and the corrosion with IRC, Water for People. We also enjoy the partnership and the learning that we're sharing with everyone in this room. But above all, we want to give special thanks to Paul and Sandy for the partnership and the research that we've put in this since 2004. We are very cognizant of changes that happen over time as we work together. And so we pay very keen attention to the learning that shape what we do. We generate the evidence and then come up with innovations like the polder riser pipe system. I know from the poll, there's some people that said, oh, we need hand pumps for the next 10 years. So Uganda has a Vision 2040, where everyone, everywhere should have access to pipe water system. Very great vision. But as we speak, in Uganda, the access to water is not, there's inequality when it comes to access to water, there's disparities. Whereas the urban picture could look different. In the rural setting, only 62% of the populations have access to water, safe water. But the access is actually predominantly hand pumps, with 69.2% of that being hand pumps. But hand pumps have had their chronic challenges since time memorial. There will always be frequent breakdowns. There are challenges that are connected to corrosions, which is the subject of discussion today, mostly arising from the kind of pipe system that is being used, but also sometimes there's limited water yield. So when there are those challenges of breakdown and limited water yield, then what happens? The solution that we thought we had brought to the people do not become useful anymore, and so people resort back to using the unsafe water points. And so that's the reason why, as WaterAid, we really want to enhance the hand pump reliability. It doesn't mean that we're not looking forward to having piped water system. We do look forward to that. But while we are still here, like Jen said during the plenary, well, you still have a mat to sit on. Please sit down and make sure you sit properly as you wait to sit on a very beautiful chair. This is just to confirm the percentage of the Ugandans that are still relying on hand pumps. And needless to say, Uganda is predominantly a rural setting. So when I say 62% rural, it's almost the population, because very few of us are urban. And so before we went into the actual work that we've done on this project, there was an analysis that was done that involved hand pumps. And interestingly, the results showed that whereas the country is predominantly using hand pumps at the moment, 23% of the hand pumps were the only ones that were found to be fully functioning. The rest were either found to be corroded or they were actually found damaged. Damaged means due for decommissioning. Interestingly, the formula for access in my country is a water point. It doesn't have to be functional, but it has to be just a water point that has not yet been decommissioned. So the 62% that I spoke to could be, you know what I mean. But if you look, and don't go into the water atlas and say, oh, the access is high. That water atlas has not been updated for a long time. So the situation is really dire. So what we did as WaterAid was to work on this innovation that we started working on since 2004, and now it's been over 21 years of research and learning and modifying. So we want to test the polderizer system, which we started doing for the past 25 months, close to 3 years now, but we call it the polderizer pipe system. Like my colleague said, we are doing things that are similar, but working towards addressing a common enemy, which is the corrosion in the pipe system. So we first tried this by testing. In 2019, we tested 6 boreholes, and these all were very successful. There was no failure. So it gave us the confidence that we could scale up. So we decided to scale up starting in 2022 to 100 boreholes in 2 intervention districts. But our approach of work is we learn together, we share, and we innovate with evidence that we have. So while we were doing that, there were some non-intervention districts that picked up the technology and tried them too. So we have some other boreholes that have been put in none. So these are district water offices investing their own money to try out Poldo because they are tired of investing a lot in operation and maintenance. But then what we've noticed over the past 25 months is that we have had very consistent water supply. Some boreholes have not broken down over the 25 months of working, and then the water quality has greatly improved, and the consumers, who are the reason where we are happy with that. In addition to the parts that were shared, one critical thing about the polderizer system is the fact that the pipes are not joined together. The existing pipe system is that when a hand pump mechanic wants to repair a borehole, they'll need an entire village to help them pull out the pipes because they're all joined together. But with Poldo, as you have opportunity to dismantle the pipes at the joints. So there is I hope this works. Yeah, so when you pull out a pipe, you have the freedom of dismantling pipes. So you don't have to remove the entire system. You only go to the pipe that has a challenge. So assuming the pipe that has a challenge is pipe number 4, you don't have to dismantle the entire borehole. The beauty with this is that hand pump mechanics can now repair up to 3 boreholes in a day. That was not something that was happening in the past. And so the technology makes operation and maintenance easier, and so communities can repair their own water systems. Yeah, so this is you see, this is just to show the hand pump mechanics working on repairing a borehole. So just to confirm, these are some of the statistics from we've done, and we did the assessment. We did a baseline and did an assessment after 25 months. So after the 25 months, at baseline, we asked users. So at baseline, about 36% of boreholes would break annually. Imagine you fix a borehole and you brand it or WaterAid, and then within a year it breaks down. If you're lucky and someone else fixes it, the branding changes too, right? From WaterAid to automation, or the DWD number does change too. So it's a slap to the funding that we put in. But then with polderizer system, after 25 months, 63% of boreholes have never broken down. And for those that have broken down, there are some challenges that are inherent to the borehole that had been selected for repairs. But also at baseline, we noticed that 18% of boreholes that had broken down had not been repaired for over a year. And the reasons could be, there are many reasons around that. The budget allocation to water services in Uganda has a formula. So the repairs have a certain amount of money above which water officers cannot go. So with the frequent breakdowns, they have to prioritize whether to repair or not. So what happens to the people that are least advantaged when the boreholes are broken down is just for me and you to ponder upon. But then in the past, for 25 months, 67% of boreholes have not required a major repair. Maybe they've required a greasing. Remember, they've not broken down, but those that required repair, maybe it was a greasing, but not a complete breakdown. We've also seen reliability in terms of boreholes being the yield of water since installation. So we realize that there's improvement across all the layers when it comes to operation and maintenance, reliability, turnaround time in repair, but also the iron reduction, the yellow water. Because not only is it repugnant, but also you cannot use the water for cooking or even doing your laundry. Just to confirm, we have enhanced functionality. When you have 63% of boreholes not breaking down, and also when you have repairs happening in real time. And also where repairs have not happened in real time, there has always been a communication gap between the Water User Committee and the Hand Pump Mechanics Association. And we've solved that problem by making sure that the Water User Committee has a Hand Pump Mechanics Association member as an advisor on the committee so that they are part of the solution when they need it. And also we've enhanced the water quality because when you don't have iron and the water is not smelling bad, quality is enhanced. But O&M, operation and maintenance, the community is being able to fix their own boreholes because the pipes are lighter, they're dismantleable, but also we build capacity of the community structures to take care of these boreholes, which enhances ownership. So what we did after after other districts started picking interest in Poldo, the thing is, even if you want to use Poldo, but it's not part of what has been gazetted by government for use, then your pathway to scale is limited because it might be a disallowable cost. So what we did was to work with Ministry of Water and Environment. The arm that is responsible for new technology is called the Appropriate Technology Center to undertake a technology applicability framework, which was done across the 2 districts of intervention. So it involves dismantling boreholes, fixing them, testing them, it's comprehensive assessment. And so we did that, and what happened is that Poldo riser pipe system passed the test. So it's a technology that government says, yes, this will help us to enhance hand pump functionality and thus contributing to the O&M framework of making sure that water is reliable for the underserved. But also what we're doing right now, we have a technical brief, so we're continuing to disseminate the results of the polarized technology to other regions. Government has decentralized the Ministry of Water and Environment offices to regional centers. So we've so far worked with 2 regional centers, but we hope to reach all the 6 regional centers. That way the engineers therein appreciate the technology, they can work with the technology, but also the community structures appreciate it and understand what to do with the technology. So this is ongoing. And for us who, I don't see people from Uganda here, but for us, the people online that are from Uganda, this is something to look out for. We also have the design manuals, and this will help for government to proceed with gazetting. So the dissemination of the hand pumps, while that happens, so the next step would be once we have disseminated and the district officers are comfortable with the technology and they believe, hearing from their colleagues that this is where they want to go, then ministry will go ahead and gazette and adopt the technology by the infrastructure and operational maintenance department as an option to be used in the sector. So we are making history and contributing to the technology framework that the country has, but paying close attention to making sure that operation and maintenance of hand pumps become easier as we look forward to making everyone everywhere have access to piped water system by 2040. So once we achieve that, yes, it would have arrived. Needless to say, we've met challenges as we do the amazing work that we do. So there are the boreholes, someone would wonder, how comes you still had iron anyway? So some boreholes that were handed over to us by government, I don't know whether they didn't have the data, but this morning we all appreciate that the sector is largely data hungry, so or data poor. So the data that was given to us after installing, we actually discovered that whereas that told us that those boreholes did not have permanent metallic casing, that wasn't the case. So while we have fixed the pipes, but the permanent metallic casing continue to corrode. And so you continue to see iron in the water. It may not be, it will not lead to rotting of the pipes because they're plastic, but they still contribute to iron in water. We've also found where we have open well designs. So what we're doing about this is to continuously flush these boreholes. But the flushing is not something that is sustainable, especially when it's for the community to take care of. But for now, that's the solution we have. And also, of course, the challenge of the delay in communication, which we've solved by making a hand pump mechanic association member part of the water user committee. And so we really strongly recommend for the use of the PVC, but also recommend that we use closed well designs as opposed to open well designs. So what we are doing is when you have a technology and it's not embedded in policy, it doesn't matter how good it is, it will not be taken up by government. So there are meetings that normally happen about the operation and maintenance framework of the country. And so we are part of those meetings, and we want to have Poldo included as part of the rural water supply standards, so that it's part of what the sector knows. And for that to happen, we have to make sure that the O&M framework is embedded in the policy. So there's an O&M framework where Poldo should fall, but until that framework is mentioned in policy, we might not have so much. But we also want to do a cost-benefit analysis for the people that have the powers to appreciate the benefit of using Poldo versus using the galvanized iron steel to help them make informed decision. But also we are working on the local supply chain. Right now we have had most of the parts being imported, but importing parts will make the technology more expensive. So we are working with local supply chain. We've had these manufacturers as part of this research. They've been part of the research from the beginning. They get feedback on maybe parts that are not working well, and so it's not something that we're just going to start. They've been part of this, but right now we have three manufacturers that we say yes, we've walked the journey together. But also we want to expand the monitoring and learning, want to continue collecting long-term data. But another thing that we see that working with communities, especially considering the O&M framework and the direction it's taking, the area service provision, where we have decided to build capacity of the water user committees to be financially stable. So we are working on financial inclusion to make sure that the money that they collect is not just put in a basket and waiting for a system to break down. Because that was another challenge that was cropping up. People didn't want to pay for water anymore because the pumps are not breaking. So we had to give them a reason why they have to continue to pay for water. And that was the Village Saving and Loan Schemes Association. And some of the boreholes have now turned into a circle, which makes them ready to be included as part of the area service providers, because they have shown that they have financial muscle to take care of water supply in an area should government look out for an area service provider. So yes, technical innovations like Poldo riser systems significantly improve hand pump functionality. Thank you for listening.
Great presentation. All right, next up is Chris Huff from Living Water.
So thank you very much. Great presentation, Comfort. Thank you so much for all of that wonderful information. My name is Chris Huff. Yes, like it says, I'm with Living Water International, and it's a pleasure to be here. And like what Michael was talking about earlier in the presentation, we're just getting started. And my presentation is more about, why is this important to us as an organization? Why I think it should be important to you as well. And so I'm going to try to make the case for that. So I want to start with first just kind of going back in time a little bit, telling you a little bit about us as an organization. As you can see, Living Water International has been around for a while. We got started in 1990, so this is our 35th anniversary. And I bring that up only because in our history, we've seen a lot of change. New technology, new strategies. And I've personally been with the organization for 16 years, and I can go back and remember a bush pump, and we quickly changed that out to the Indian Mark II, and then we've moved on in some cases to the Afridive pump. All of them have pluses and minuses, great pumps, but there's always a need for improvement, and always looking for a better design with better components so that we can do what we love to do, and that is serve the people in those communities and provide clean drinking water. And so that's why we're here. I talked about strategy, and so one of the things that has changed is how we work with communities and local officials and governments. We know that we need buy-in. We need them to get excited about the work that we're doing. So staying focused in an area has been really important to us. I bring this up to say that we're really passionate about sustainability. We've talked about sustainability, we've talked about functionality, and so we need people to come around as partners, community members, and government officials to make our projects sustainable. But we also need to understand that in order for us to achieve those high numbers of functionality, we also need a pump that's going to be designed well, and it's going to have materials and supplies that's going to last for a long time, which will allow for the longevity of that system and also reduce the cost of maintenance, which is critical for the community members. So as you heard, we are, as soon as there it goes, we're getting started with the Max Life hand pump project in Zambia. And so I'm going to talk a little bit as to why was that important to us as an organization, Living Water International. So first of all, Zambia is a big country. It's got 19 million people, and out of those 19 million, 34.6% lack access to clean drinking water. And so for us as an organization, we knew that there was some work to be done. We can get in there with other organizations and the government. The government was very open to others coming in to support them in trying to provide safe drinking water to their people. We work in 2 locations. One is in Chipata. This is a WPA of ours, right there on the border of Malawi. And as you can see, those numbers are not slightly higher. They're very much higher than the national average. So more than half of the population, when we first started looking at Chipata as a possible WPA for us, a WASH program area for us, we were looking at those numbers of more than half of the population without clean drinking water or safe water. The other thing that's quite unique about Chipata is that out there they have a very distinct wet and dry season, and if any of y'all work in Chipata or near there, you'll know that they've had quite the severe drought here lately, which has really forced a lot of the communities to really use their hand pumps that they have available to them, and using our hand pumps that we have installed over the years, which means, again, why is this important to us? Because we want that pump to be able to perform well through the rainy seasons, through the normal or extreme dry conditions for years and years to come. And so we're very interested as an organization to have a hand pump in place for when those sorts of events occur, because it's not going to be the last time. They're going to go through droughts again in the future, which is going to put a lot of stress on that water delivery system or that hand pump. But we are going to get started with the Max Life project, hand pump project in Kimbe. Okay, so we've got 2 locations. I'm sharing this one with you because this is where we're going to install 40 Max Life pumps here very soon. Same thing, you can take a look at the numbers. More than half of the households there lack access to safe water. Okay. The other thing that was interesting about this location when we first started to identify it as a WPA for us is that they had some boreholes already constructed, but they were in institutions, which is great. We love that, and that's how it should be, but sometimes those institutions like schools, they close down, which means that the public doesn't have access to that water point. And so we knew we could work in there. And so anyway, I share this with you only because this is where we're going to get started. So we're very excited about the project that's about to kick off in hopefully a couple of weeks. So what are some of the common issues? You've already seen slides from Michael on this, where we have centralizers that are dry, they crack, and when they crack and break, what happens to them? Those pieces fall down inside of the working barrel and into the cylinder, and then cause other problems, bigger problems, more costly problems, okay? We also have situations, or we have seen, not only in Zambia, but in other parts of the world that we work in, where your galvanized riser main suffers from corrosion, okay? It's metallic. If the water is aggressive, then it's going to have issues with corrosion. And so we see that a lot. Speaking about aggressive water, Zambia is quite unique in that regard. There's been plenty of studies, research showing that the pH level of the soil in Zambia is quite low in areas, especially in the areas in which we work. This has an impact also on the aquifers as well, that it creates a situation where the environment in which we install hand pumps in are sometimes what I say aggressive water, which causes the galvanized riser main not to perform as well in other parts of the world, to the point where you could install an India Mark II, and after a couple of months, 6 months to a year, you're already starting to have problems, especially with water quality. Community members have stopped using hand pumps because the water that's coming out of them is no longer clear. It's yellow, it's orange, okay? And nobody wants to drink that water any longer. And that's a problem for us because we have worked really hard to mobilize the community, get them excited about the projects, but because we have corrosion issues, then they don't want to drink that water any longer. And so that's a problem for us, and we're hoping with the Max Life hand pump that's going to not only reduce it, but eliminate that issue altogether, so that we have communities that are excited about using their hand pump. I shared this slide only because I'm up here speaking to you today about Living Water International is excited about the evolution of hand pump design, but we're not the only ones. Zambia has recognized that it has a corrosion issue as well. And the government of Zambia has reached out to other NGOs, other countries, to ask for help in resolving this issue. Even back, as you can see, the first window here, in 1985, they launched the first project to try to address this corrosion issue, in which they installed more than 500 hand pumps that had something different. They had stainless steel riser mains and sucker rods, which greatly reduced the corrosion and allowed for not only the community to be happy with their water, but also reduce the maintenance necessary on those hand pumps. That study went on to kind of fuel other research and study, and it's still going on today. I could have easily put 2 or 3 more slides up here about all the work going around or about how to reduce corrosion in Zambia, but we didn't have enough time to go through all of those slides. But just understand from me, this project is adding on to a long history, a long journey of improvements to try to help Zambia with its corrosion issues. For us as an organization, we've done our own internal investigation on functionality. So I shared this with you just real quick to show you that back in 2017, we ourselves looked at 3,800 plus hand pumps of ours, systems of ours, just to check to see how we were doing. And what we found was that 77% of those were functional, which is not bad, but we knew we could do better. So everything that I've shared with you about the corrosion in Zambia, this internal study as well, our desire for sustainability are all the reasons why we're excited about the Max Life hand pump project in Zambia. We're looking forward to it. We're hoping that you come back in a year and we'll have some results similar to what Comfort has shared from Uganda, because we're just now getting started. And so stay tuned. But what's going on right now? So as of September, we had our first training with Design Outreach and 7 of our Living Water staff in Zambia. And it was a great training. It was the first time our Living Water staff had a chance to touch, to hold, to see, and to learn from the Design Outreach team. And Jeremiah was a part of that. He may share a little bit about that here in just a minute. First couple of days, classroom experience, getting an understanding of what makes this Max Life pump different than a standard Indian Mark II. They had an opportunity to look at the components, see the difference in the design, and really ask a lot of great questions and get their hands, what I say, get their hands wet or get their hands on the components and get an understanding for what's expected. The third day was all about just practice, practice, practice. Getting the pump out to the field, installing it, extracting it, installing it again, practicing on how to do it smoothly, because I don't know if I said this yet or not, but we have 40 Max Life hand pumps on the way. And so I wanted for our team in Zambia to be comfortable, to be ready to go. And so this was a great opportunity for them to work with design outreach team to get comfortable with the new Max Life hand pump. And then the last day, day 4, they were successful in installing the very first Max Life hand pump there in Zambia. And so that was a celebration and a great day for them. As you can see on the top right, we pulled out an old Indian Mark II with galvanized piping, and you can see the color. It's a little orange. So corrosion issues were setting in on that one. So what were the training results? The training was great. As I said, it allowed for our team to practice, 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 allowed them to sit with the design outreach team and really get an understanding of what individual parts there were that make up the new design, ask a lot of questions, get the practice of installing and extracting that pump. And so it was a great success. There were a few challenges along the way, but I like to train. I usually go out to the field and teach guys about equipment that we use. And I always like it when there's a few challenges along the way, because that always creates questions and how do we handle this and what do we do? So they had a few of those, and so they were able to work through that, which was really great. And so a lot of learning that occurred. What's our next steps? So our next steps, just like I said, we have a container of Max Life. We have a container of hand pump components that are coming in that we will then combine with the components to the Max Life pumps that we already have in Zambia. Once those two come together, then of course we're going to do like everybody else. We're going to go through the inventory, make sure everything is there, and then we're going to get started with installation of the 40 Max Life pumps. We're going to have 20 that are going to go into new boreholes and 20 that are going into rehabilitated wells. And then over the next couple of years, we're going to monitor and hopefully come back and share some more information with you about the performance, how well they're doing, and how we're able to not only provide good water quality to the people that has received these Max Life hand pumps, but also how it has reduced the frequency of maintenance and reduced the financial burden on the communities that have received these pumps. So, with that being said, I'm going to hand it over to Jeremiah. So thank you very much.
Thank Chris for his presentation. Jeremiah is going to help us wrap up, and we'll have a time for Q&A afterwards.
Please hang on there. When you encourage and you have a 2-hour session, it's sometimes boring. Yeah. Yeah, so this is the last part of the presentation. I hope to be the best. So I'm Jeremiah once again, Sakara from Malawi. I'll present on the same Max Life, but zeroing in on experiences from Malawi. So Malawi is in a Central African country. We are about 21 million people, and over 80% of those people are in rural areas. We are called the warm heart of Africa. We are very friendly people. But I would want to take you through the water access challenges that we have. We only have 67% of water access, and 63% 30% of the population in rural areas are the ones that have access to safe water supply. And for women, you appreciate that water collection is done by women, and it takes almost 30% of those women to access water. They take about 30 minutes around trip. And suffice to say that in those rural areas, most of the water is collected from hand pumps. And the most common hand pump is the AfriDev, as of a survey that was done in 2019 and documented in a document that's called Professionalizing Water Supply. We had about 52,000 AfriDev pumps across Malawi, but we are close to 70,000 now. So, as Michael did present an introduction about what design outreach does, in Malawi, design outreach is more like a training base to do even advocacy for our technologies. And we have a record of having introduced a pump within our region and having it approved by the government. This is the life pump that was talked about earlier, and this was approved in Zambia as well as in Malawi. So the Max Life project, I will just kind of repeat. Michael talked about the same. We have about 4 goals. We want to improve fast wearing parts so that instead of having them replaced every 6 months, of course, in other pumps that have been replaced in less than 6 months, sometimes even less than a month. So we want these parts to last about 2 or 3 years or even more. We would also want to ensure that parts that are very expensive do last over 10 years. And we also have this issue of corrosion. We want to eliminate corrosion in hand pumps. And last, we would want to continue advocating that standards be maintained or improved, going up in future. So what challenges did we find with our pumps? There was a study that was done by Design Outreach with the Rural Water Supply Network. We realized that most of the breakdowns that were related to hand pumps, AfriDev in particular, resulted from some. There was a survey that was done to establish the breakdowns, and we realized that most of those breakdowns emanated from the fast wearing parts, especially the road centralizer. So Design Outreach and Portal Designs thought maybe the first thing to look at was supposed to be the centralizer, and they designed a floating centralizer. It's the blue centralizer that I want to show you here. This is the centralizer that was designed. And these centralizers were tested initially in 2023 on 126 pumps, and we had a webinar to demonstrate performance of this. And these were first tested with our colleagues called Fisherman's Rest. After a year, it was realized that about 80% of the challenges were solved. So Design Outreach continued to do the field tests by involving the government and other partners, and so far we have installed these parts on about 500. So Design Outreach alone went further to dive deeper. So we roped in our colleagues called WHH, who have their water supply projects in a refugee camp. This refugee camp has about over 50,000 people, but very few water points, about only 37 hand pumps, and of course they have some piped water systems, but the water supply access is not adequate. So we went there because we felt we would find high-use boreholes and would effectively test this and give us confidence in it. So we went to 2 pumps where we installed these centralizers. And after 5 months, we went back. I should mention here that before we went with this particular centralizer, these pumps could have the centralizers, the black rubber centralizers, these ones, having replaced every 2 weeks. And when they were going to replace these centralizers, then they would also replace the seals because there was a knock-off effect affecting the seals down there. So we went back to these pumps. After 5 months, we found that there was no need to replace this. There was even no need to even touch the seal. We went there again after a year, and that was in May this year, just to inspect. That's how we found the centralizer. So after a year, this is a new one, it does not work. I don't know if it looks different from that one. And it gave us confidence and our partner that this is the solution. So WHH put it on their plans to put these on all the pumps, and they started with 20, but they will still scale to include these in all their pumps. We also went further to specifically work with the government of Malawi through the Ministry of Water and Sanitation to do a demonstration in one of the districts. So the goal was to just do this demonstration for 1 year so that we learn from practice. So as you all know, maybe some of you know, to work with government, there must be some engagement. So we did a stakeholder partnership workshop to introduce this concept of the Max Life. And we also went down to the district which we were given to work to also introduce the same. And after that, we wrote the ministry to give us a consent which we were duly given. After the consent, we went on the ground. We started with working with pump mechanics. We had to do a training because this being a new concept and the traditional way of working with rods and centralizers was that these would be connected this way, and it was easy for anyone working with AfriDef pumps to put this centralizer on. But how would you envisage putting this one on a connection that is like this? So we had to train these people because ideally these rods don't have an end like this. There will be an eye like you see here. So this one is also called a snap fit centralizer, so we had to train them on how they can fit this one. So those were pump mechanics that we worked with, so that they had to be comfortable to work with the floating portal centralizer. We also had to engage the community members, introduce the new concept, and we moved together going forward. So during installation, since we had done this demonstration, the communities were excited and they joined us to do the installation. That's the picture you see there. Just to also bring to your attention that there was a heavy burden of maintenance on water committee members. This is what one community had kept as parts that were replaced on one borehole. And you can appreciate if when we brought this how much money this community has saved. So what results have we generated from this? The results are many, but just to mention a few, we've seen that after 9 months to 1 year, there's been no need to replace the centralizers, sometimes not even the seals. In some boreholes, there was only one replacement of seals over the period. We also noted that maintenance burden on water point committees and area mechanics was substantially reduced. But the most important lesson was the last bullet. We realized that some of the boreholes that were abandoned did not really have issues with the availability of water. It was rather community members or committees getting tired to service the pump. And as we were working, like I indicated, in one of the districts, we were doing a demonstration with the government. We got feedback from whoever we worked with. So we had a ministry official who was our desk officer. He had to say these centralizers have demonstrated that they are robust and will potentially improve pump reliability, and the government is keen to continue monitoring to see where we get. And then a pump mechanic in one of the districts, he said these new centralizers have indeed drastically reduced calls for maintenance from water committees, and this gave him a chance to even attend to more pumps in his area. The final comment was also from a pump mechanic who said, oh, these are the centralizers we've been looking for. I will encourage my water point committees to go for these particular centralizers. This was very great feedback for us, because as we were already convinced when we produced this that it's a solution, but it was great to get that feedback from the ground. So going forward, where are we going? We are pushing for a final approval by the government so that we can scale use of these centralizers so that more pumps can benefit. We would also want to have planned to train all the mechanics in Malawi so that they're able to install these centralizers. We also want to find manufacturers within the region so that we can benefit from several regional protocols in terms of reducing landing costs of centralizers. We'll also work with supply chain systems so that these, once approved by the government, they are available in the available supply chain systems for anyone to buy. So having reached this far, thank you so much for your attention.
All right, thank you, Jeremiah. And let's give our presenters a round of applause again. And thank you. All right, the rest of the time's Q&A. So if you have a question, we could either pass that microphone around back there just so the online participants can listen in on the question, or you can step up to the microphone as well. Do we have a question? Hey, Greg, can you grab the microphone back there? Maybe you help me out here. It's nice when you can tell the CEO what to do. We had a question up here. Thank you, Greg.
I have two questions. One is, are there commonalities between the innovation in each of the three countries in what you're changing? And the other is, I understand that there's a lot of savings on the O&M piece of it, but is there some increase in the upfront cost that is with the innovations? Just curious about cost implications and where they might be.
Who'd like to take that one? Michael, you want to talk about the similarities?
Yes, I'll do that.
Yeah.
So good question. Thank you. Is this one on?
Yep.
Okay, excellent. So, there's a commonality between Comfort and WaterAid and Paul Dahl's work in Uganda and Living Water, DO's work with Chris in Zambia, and that's that they both use the Paul Dahl riser pipe system. So those two systems are very similar. There's maybe a difference in the kind of centralizer design since we're using the blue snap fit centralizer in Zambia. So, those are very common. The work done in Malawi that Jeremiah just talked about, that's the AfriDev pump. So both AfriDev and India Mark II is in Zambia and Uganda. They're both part of our upgrade project. So, yeah, anything you want to add to that? Any of the panel?
Oh, thanks, Michael. And I think Comfort was going to answer about cost.
Yeah,
then.
I want to talk about the cost implications. So what happens is that the cost of, if I had a hand pump that had the galvanized iron pipe system, and I wanted to change it to Poldo, the cost would initially be almost the same because you also have to change the pump head. But the benefit that you get is that when you repair a pump and you put in the same pipes, then they'll rot again. But with Poldo, when you fix the pump, then you have, at least so far we have guarantee of 25 months and they're still counting. So that's what the district water officer, that's what is inspiring the district officers to take on the Poldo because of the long-term cost benefits of not breaking down and the improved quality of water.
Great. Jeremiah, do you want to answer the question related to cost about the AfriDev Max Life upgrade?
Yes. So on cost, yes. Somehow we are also answering to the question that we started with: can technology improve things? So, so for a long time we have looked at water supply issues to do with the social fabrics. We have kind of forgotten how much technology can impact on the lives of people. So we thought of improving things, but still making them affordable. So in all these technological improvements we've done, we've kept in our mind the fact that they must be produced at a very low cost and made available to the communities at also a very low landing cost. So we are improving the pumps, but we're also trying to make them affordable.
Yeah, and one of the really incredible things about the centralizer is that it's affordable by the community. So it's a very low cost component. It's slightly a little bit more expensive than the black rubber centralizers, but still not, you know, an order of magnitude more. It's affordable for the communities themselves. All right, Catherine.
Thank you all so much. I'm wondering if you could talk a little bit more, I think Jeremiah specifically, about that government approval process that you mentioned. So I think the quote said that they'll continue to monitor and that they think they may improve reliability or whatever they said, but can you talk a little bit about specifically what they're looking for and in what situations and you know what it will take for them to sign off, maybe in the way that we heard about the ATC in Uganda, just what that process is.
Yeah, thank you, Jeremiah.
Yeah, thank you so much. So, yeah, every government has its own standard way of doing things. Initially, when we embarked on this project, we wanted to do the testing for 6 months. And then when we were doing the 6 months assessment, is when we started getting this type of feedback. But the government kind of told us that for us, for any new component, we are safe to test it for about 1 year or more. So this is why the extension of who continue to monitor came in. So we also adjusted our programming. Okay, let's follow what the government set for testing of new components. But we are very confident as we're getting to 1 year, the government got convinced already and we are too confident we are getting the approval, because everyone is able to see how effective this has been. And for our colleague at the refugee camp, who were like maintaining a pump every 2 weeks, the outlay that was going towards maintenance was very substantial, and they can see the impact at the moment. And they have very good testimonies to back this particular component for approval by government.
Yep. Thank you, Jeremiah. Yes.
Yeah, thank you so much for the presentations. Peter Kadu from Uganda. Comfort, I think you're comforted. Yes. So just, going back about the question on cost, I understood the response around the replacement cost. What about if one is just setting up a hand pump from from stage 0? Any comparison in cost around that? And then a question as a non-wash expert. Looking at the centralizer on the one hand and then the pipe system, is there any work done combining both components? Because I think if it's a possibility, it seems to be something that would be exciting. I wanted to know whether that has also happened.
Yeah, I can answer the first question, your last question first, because that's the easiest. So the answer is yes. So both systems use the centralizer. So they have a floating centralizer in both the Paul Dot riser pipe system and the Afrodev system. So that's kind of a key component for both. So there are some common components then that would be between both systems. And then in terms of like a brand new pump for borehole comfort, do you have the cost comparison between? Oh, Sandy would be good. Sandy, are you able to answer that question?
Yes, indeed. The cost, can you all hear me?
Yeah, you're a bit quiet, but
Sorry, I'll get a bit closer to the microphone.
Thank you.
The comparison, firstly for Uganda, is between stainless steel pipes, which is the government mandated system these days to cope with corrosion, and the pole door system. If you upgrade a pump with galvanized iron pipes and change it to stainless steel pipes, you spend a great deal of money, close on $1,000 if it's a deep well, certainly between $1,500 plus. The pole door system, between 800 and 1,000. The pole door system is cheaper than that. If you're starting from scratch on a new borehole, then the pole door system costs about the same as a standard galvanized iron U2 pump, maybe 10% more, but it's in the same ballpark. So those are the two comparisons. A retrofit, which is what's happening in Uganda a lot anyway, with stainless steel pipes, where we are the same cost roughly as stainless steel pipes, or new pumps where we're a lot cheaper than stainless steel pipes because we're about the same cost as a GI pipe system. I hope that's not too unclear.
yeah, thank you, Sandy. Yeah, so cheaper than the stainless option, about the same as, maybe a little bit more than the galvanized, but in terms of corrosiveness, it would be equivalent to the stainless steel, so a better deal on that, a better value on that end. Yeah.
Am I allowed to answer a question?
And on the Malawi case now, an Afrodev pump, a new one, would cost around $500, but when you use those centralizers, we just add about $30 to the 500, which is about less than 10% of the cost of the pump.
Mm-hmm.
Of course, we would say, okay, the cost of installation has gone up a bit, but this just will drastically reduce the cost of maintenance, because every time a water committee calls a pump mechanic to service, they have to pay him, they have to buy new parts. So for a part that stays on the borehole for 2 years without being replaced, it means it reduces calls for maintenance 8 times more. and it also reduces the cost of replacing that particular part by buying a new one, maybe 3-4 times more. So we are like improving, or maybe just adding a bit of initial capital cost, but reducing a lot on the maintenance cost and making pumps more sustainable.
That is a critical point. Thank you, Jeremiah. Greg, I think you wanted to add something as well.
Yeah, just talking about the cost of the AfriDev specifically, with the new centralizer, the black rubber centralizer is about $2 equivalent in the market today. Every pump might need 10 of those, and the new centralizer is about $4 equivalent. So for a very small difference in price, we're actually doing a 5-district, 3,500 pump pilot to demonstrate the willingness to pay. So that's a great question, and that's the user being the customer, not the NGO, which is really key for this to scale.
Wonderful, great questions. Any other? Yes, we have one here, and then we'll go to the front next.
Yeah, I'm Tanner Hoffman. I'm Director of Program and Operations for the Ugandan Water Project. I'm curious to know more about the riser pipe system in particular. I know with UPVC pipes, the main limitation, as I'm familiar with, is the depth at which you can install them. You can't go beyond a certain depth. So I'm curious if your system has some of the same limitations there. And then just more generally, how does your system compare to UPVC options that are currently in the market? Like, what are the main differences there?
You want Sandy or Alfred to answer that question, or?
I know it's up to 17 pipes, but yes, Sandy can pick it up.
Okay, so we'll pass that on to Sandy or Alfred if you would like to answer the question.
Thank you. Yes, it's a very good question, and I was hoping somebody would ask this one. Firstly, the PVC system that we have designed and developed is substantially stronger than any of the other PVC systems that are currently on the market. So we've designed it to go to a depth of 20 pipes or 60 meters, which is actually in excess of what the U2 or India Mark II hand pump is technically specified for. And we've tested it up to and beyond 20 pipes in the last 2 years. So that's the first thing about it. It will go deep. The second thing is that the diameter of this pipe is considerably larger than any of the other PVC systems that are currently sold for the U2. And that enables us to extract the plunger and foot valve through the pipe. And that makes a major difference to the regular ongoing maintenance, which is mostly about replacing plunger, bucket seals, bobbins, etc. That operation can now be done in under 1 hour instead of several hours, and therefore is a massive saving on long-term regular maintenance. Thank you.
Great, thanks, Sandy. Yep, thank you for your question. I think we have one more question in the front here.
Sure. So my question just relates to supply chain and then access to spare parts within countries. What is your current reach or vision for reach beyond the 3 countries and Africa?
Do we have any takers for that question? So expanding outside of the 3 countries? All right, I guess I'll take that one. Yeah, as you mentioned, as we've been talking about, each country that we are working in has specific regulatory environments that we are having to walk through. And we're hoping that as we make a big impact in these 3 countries, that will gain some attention and it will start to expand. We're working with manufacturers to make sure that these solutions are available to whoever would like to purchase them. And one of the original goals when we teamed up with Paul Designs on this project was we're like, okay, we don't want to be a tinkerer that just throws a design over the fence and thinks it's going to work. We really want to lock arm in arm with a lot of different organizations. That's why you saw that big long list of advisors and partners. We really wanted to lock arms with people to make sure that these upgrades made it across the finish line, into the supply chain, into the markets where they're being used. So our focus right now is we really want to make a big impact in the 3 countries we're working in, and then expand from there. But there are lots of opportunities. in terms of other countries, we've received interest from NGOs that are working in other countries. So those are ongoing conversations that we're having. Yeah. Looks like we have one more question here.
I think it's maybe more of a comment, but are you also planning then to continue to work with RWSN, because that seems to be a good place to like keep spreading the word about the innovation and maybe create some kind of community of practice there?
Yeah, definitely, and we've been able to be part of their Stop the Rot action group. So that's been a extremely important part of this work that we've been doing, and getting feedback from them, and being a part of others who are also working on upgrades and thinking about not just from the technical side, but policy side, like what can we do to make improvements and truly stop the rot and address the issues that hand pumps have. Yeah.
And we've actually had two webinars in the past.
Yeah, thank you.
With RWS and webinars, November 2024 and then June of 2023, if I have my dates right. And if all goes well, we'll have some more in the future. So yeah, they're a great partner.
Thank you, Michael. All right. Well, if there's no further questions, we want to thank you so much for attending our event. And we have one final announcement to make.
And please join me on Wednesday in the Godwood room. I don't know how to say the right names of the rooms for a verbal presentation on integrating WASH interventions in communities, healthcare facilities, and schools, and how that, when well structured in a strong governance system, gives you sustainable results even in the most difficult situations, including refugee settings.
Great, thank you.
It's at 3:15. Or you can look into the program and see my name and just come where I am.
All right, and thank you to all of those online who joined us as well. Thank you. Have a wonderful day. We have samples up here if anyone wants to come and take a look at the parts. We have a few samples that you can check out.